So you've been diagnosed with Hashimoto's or you're suspicious that you might have the disease. So what's next? No matter who we are or what our diagnosis is, it's always important that we understand the realities, the facts, and most importantly, the possibilities for improvement. By the end of this video, you'll be able to better define Hashimoto's, know how to strategically approach the condition, and you'll know that people need to be more careful or more clear when they use the term reversing Hashimoto's. If you're interested in natural strategies to help support your Hashimoto's and your thyroid gland, make sure you subscribe to my channel and ring the bell. That way you'll be notified when I post a video each and every Thursday. Also, make sure you hang with me all the way to the end of the video where you'll get a chance to download my free guide, 109 Foods to Boost Your Thyroid Gland. My name is Dr. Brad Bodle, and I've helped hundreds of patients with Hashimoto's lose weight and improve their energy naturally. And one of the main themes that I see from patient to patient that is a predictor of success is that they more comprehensively understand the condition, their immune system, and their thyroid gland. When we can do that, then we can much more easily and efficiently work as a team together and have better outcomes for your health long term. But let's start out by defining Hashimoto's if you're not familiar with the details. Now, Hashimoto's is estimated to be the most common autoimmune condition in the world, and it accounts for about 80 to 90% of hypothyroidism cases in countries with enough iodine in their food system. Remember, hypothyroidism is just a description of labs and symptoms. It doesn't tell us where the problem is coming from. So if you have elevated TSH, low T4, you are going to be diagnosed with hypothyroidism. But for many people, we need to understand that Hashimoto's, or the autoimmune aspect of things, is also in play. But what is actually occurring with autoimmunity, and what does it mean to have an autoimmune disease? Normally, our immune system is there to help us to defend from outside invaders, things like bacteria, viruses, and parasites. But in the case of autoimmune conditions, what happens is instead of creating proteins called antibodies for those bugs, we create them for our own tissues or glands. The mechanism between different autoimmune conditions is similar, but the target site or the tissue or gland that's being affected might be different. That's where we get the different names depending on the part of the body that's being affected. So for someone with rheumatoid arthritis, they have autoimmunity towards their joints. For someone with multiple sclerosis, they have autoimmunity that is targeted for their brain. With Hashimoto's, the autoimmunity is for their thyroid gland and can impair the production of thyroid hormone. To define Hashimoto's, what we have to do is a blood test where we look for TPO and TG antibodies. So again, antibodies are the proteins that our immune system makes to fend off invaders, but we are creating them in this case for our own enzymes and proteins within the thyroid gland. These antibodies have a particular shape to them. They fit to a particular thing, kind of like a lock and key. You have one lock for one particular key. There's specific shapes there that allow those things to match. So the protein structure of that antibody actually fits directly to TPO or thyroglobulin. In fact, this is how our immune system has memory for things like viruses that we've been exposed to in childhood. Once we are first exposed to that virus, we create specific antibodies, specific proteins for that virus, and if we are ever exposed to it again in our later lives, we already have that matching antibody ready to help fend off that virus. Now, understanding this concept of antibodies and immune system memory is key to understanding Hashimoto's. Just like we can gain lifelong immunity from some sort of viral infection, our immune system will also maintain that memory for our thyroid. What that means is things like Hashimoto's, things like other autoimmune conditions are lifelong, they are progressive, and therefore we have to manage them in a way that reflects that. Keep in mind that the development of thyroid antibodies usually occurs about 7 years before someone is diagnosed with hypothyroidism. And what that means is that although there's damage going on to our thyroid gland through that entire time period, there isn't enough damage to cause the lowering of T4 and the elevation in TSH. But people can still have symptoms during this time. So if you keep going back to your doctor and they say, well, everything looks fine, your lab test looks normal, I don't know why you're having these low thyroid symptoms, you may want to get TPO and TG antibodies checked as a first line of defense because those can cause those symptoms that you're having. And again, the TSH and T4 changes don't occur until later. So the idea that Hashimoto's is lifelong can be a little tough for some people, and that's totally understandable. But if we have proper strategy in place, it doesn't mean that we can't have good outcomes and good success with our health. I always use the simple example of a sprained ankle with my patients. If we sprain our ankle, that joint is forever going to be different. It will not be like it was before the actual injury. That being said, we can do a lot of things. We can have a good plan in place to rehab that ankle and get it back to a level where it's functional for us and we can do all the things that we want to be able to do. Of course, we have to keep in mind that we need to be aware that that ankle is different. So although we can get it to a point where we can go on a run, go for a hike, whatever it might be, we may need to do things like tape up the ankle before going on that hike. We may need to ice it afterwards because again, it is different, but it doesn't mean that it can't be functional. Just like with our ankle, with Hashimoto's, we have a thyroid gland that isn't the same as it used to be. It's been injured. Therefore, we now have to assess the triggers that can stress that thyroid gland out and minimize those in our life to promote healing and recovery. Everyone's going to be a little different, and there is no one-size-fits-all approach to Hashimoto's. We're all going to need to figure out what our personal triggers are and manage those appropriately. But here are some of the things that you can look for that are commonly issues for people with Hashimoto's. That includes gut dysfunction, blood sugar dysregulation, hormonal imbalances, chemical load, changes in biotransformation pathways like liver and gallbladder dysfunction, and emotional stress. If we know that any of those things are triggering or irritating our immune system, we have to minimize or manage them. That way we can take the pressure off of our immune system by reducing inflammation and allow our thyroid gland to heal more appropriately. When this happens, we can actually see great improvements in our symptoms. So although Hashimoto's is lifelong, it doesn't mean that our symptoms are lifelong and we can have a very high quality of life. So I know it can be frustrating, stressful, and sometimes hurtful when you're talking to friends, seeing people on social media, and you feel like everyone else is out there living their best life and you're missing out on that. Don't give up hope. There's still possibilities for improvement. We just have to make sure that we're attending to the right areas for you. Now, I know it can be a little tough to understand the dichotomy here, but it's important that we're in the right headspace and we have the right attitude for Hashimoto's. Yes, it's lifelong, but that doesn't mean that we can't have a high standard of living and a great quality life. But we have to shift our mindset away from the idea that we're going to get rid of Hashimoto's and instead realize that it's something we need to manage. Flare-ups are a virtual certainty, and we are going to have them in our life. However, if we can better understand how our body works, understand what triggers are involved, then we can minimize the frequency of those flare-ups, reduce the intensity, and also get back to healing and normal health in a much quicker fashion. I always mention to my patients who are in the middle of a flare-up that we have to double down on the things that got us out of the chronic inflammatory state in the first place. So if our eating hasn't been as good, if our stress has been a little high, if we're not managing our supplementation like we should be, then all of those things are critical to make sure we get back on track. Now, if you've been diagnosed with Hashimoto's, how long did it take you from initially noticing symptoms to eventually receiving that diagnosis? And what sort of things have been helpful for you along your health journey? I'd love it if you'd share your thoughts, and you can always do that by leaving me a comment below. So if we've been managing our triggers, we are on track with our health, we're noticing improvements in how we feel, and our labs are objectively moving in the right direction, the big question still remains. Can Hashimoto's be reversed? And I think we have to ask ourselves, what do we mean when we say reversed? Can our symptoms be reversed and allow us to live a much healthier and fulfilling life? Absolutely. But just because you're feeling great, and even if your antibodies are within the normal range, that does not mean that Hashimoto's is gone. It is lifelong, and your memory within your immune system will always be there. So if you go back to doing the things that initiated or perpetuated your autoimmunity in the first place, that will cause a rise in antibodies and can lead back to some of the symptoms that you were noticing at the beginning of your health journey. Now, the reason I say this is to not be negative. It's not to be a downer, and I hope you can understand that it's coming from a place of a lot of love and support. I want you guys to understand what's going on with this condition, and I want to be real with you. And the only way we can do that is by being clear about what the expectations and prognosis is. I want you to have the most happiest, fulfilling life, and I know that that's possible. But we also have to understand that your life as it currently exists is going to require some sacrifice, it is going to require some changes, and things will look different on the other side. But as long as we're doing the right things for our health, different can be a very, very good thing. I know we covered a lot of different factors today that can influence your thyroid and immune system health, but one of the big ones is making sure that our diet is correct. Now, everyone's going to be a little different, and each of us is going to have our own nuance, but there are certain tenets that are relatively general for people with Hashimoto's and can give us a good starting place to begin making some of those changes. To help you take those first steps, I designed a free download called 109 Foods to Boost Your Thyroid and Support Your Energy. It's a comprehensive list of foods that I use with my patients every day, and it's a great starting point for people with Hashimoto's and other autoimmune conditions. And you can download that from the link in the description below. If you like this video, don't forget to give it a thumbs up and subscribe to the channel. These topics can get a little tricky, so if you have any questions, feel free to leave me a comment and I'll get back to you. Thanks as always for watching. I really appreciate it, you guys. I hope you're doing well, and I'll see you in the next video.